So I think that the first thing to sort of recognize is that substance use disorders, whether it's alcohol, cocaine, heroin, some club drugs, et cetera, is incredibly common among patients with HIV. And in fact, we know that approximately 50% of HIV-infected patients are dealing with some level of substance use disorder. The problem with underlying substance use disorders is they really have a negative impact on the HIV treatment continuum of care. Anything from getting diagnosed, so getting tested, getting linked to care, getting CD4 monitoring, retention in care, getting antiretroviral therapy, and adhering to antiretroviral therapy. And then for those individuals, probably as a consequence of not being engaged in care, they're also more likely to have premature morbidity and mortality. So those are all factors of doing that. Now the issue is that most underlying substance use disorders are treatable. And so it's really important to make sure you, first of all, diagnose them. And then once you diagnose them, you can intervene. And that intervention can be anything from a brief intervention that can occur in about 5 minutes in a clinical care setting. And then the next part of that is either referral to treatment or providing, ongoing treatment. So with regard to the first thing, which is screening, it's important to do this, and you can do it very quickly with a number of different mechanisms. There's a number of routine screening tools that are available for alcohol, for other drugs, but you have to ask the question first. Once you identify that there's a problem, you need to sort of understand a little bit about how severe it is. And then after that, you need to really provide a brief non-judgmental intervention. And that non-judgmental intervention has really got to sort of normalize the drug use and saying, this is what's going on, this is how it may be contributing to poor consequences. You are empowered to do something about this. Let's start by reducing use, but let's also get you some additional treatment services. Now, in places that don't have access to effective treatment, sometimes they have to refer them off-site. That's okay, but you actually can optimize the services if you provide it on-site, if you possibly can. So the International Association of Physicians in AIDS Care has really recommended at least 3 interventions to improve HIV treatment outcomes. One of them is to provide medication-assisted therapies for either alcohol or opioid dependence. Those are the only 2 for which we have effective treatment. Counseling and behavioral therapies for the other sorts of drugs like stimulants. And then I think ultimately we have other options such as directly administered therapy. That is really almost resource prohibitive in many places unless you have a small community and you have people who are interested in engaging in that. And then the other sort of benefit is integration of substance abuse treatment into HIV clinical care settings. And there's really good examples in numerous settings from around the world where they've effectively done that, and they've really improved a number of outcomes, not just the substance abuse or the HIV, but it also has improvements on TB, other quality health indicators, getting your CD4 monitoring, a number of things that we would consider to be good care. The challenge is that in the integration of services, it's really getting one buy-in from the clinic and to get individuals to really build up a cross-training skill set to be able to treat more than one condition in the same way that we've learned to treat HIV and TB, or we heard lectures today about HIV and Hep C. We have to be able to do all of this within one setting. So it really means that as clinicians, we have to become somewhat pluripotential and be able to do a lot of different things. But it's effective, and so substance use disorders are not going to go away. They're there, they're diagnosable, they're treatable, but we have to really use the effective tools that are available in order to optimize treatment outcomes.